So after the craniotomy has been performed and the covering or the dura over the brain has been opened, this is the initial view under the microscope that we get of the sylvian fissure, which is the fissure that separates the frontal and temporal lobes. On the right side of the screen is the patient's left frontal lobe, and on the left side is the left temporal lobe. Currently, I'm working to open the sylvian fissure. As you can see, there are large veins, and by using instruments and separating those veins from the surrounding brain, I'm able to open this, which will allow access to where the aneurysm is. Periodically, you do have some small bleeding from these small vessels, and treatment with cautery, which was done there, is typically preferred if possible. Further dissection a little bit deeper into the sylvian fissure itself. As you can see, the vein now is quite superficial, and you can see more of the brain on either side. A retractor has been added on the right side to assist with retracting the patient's frontal lobe, and I'm continuing to open the sylvian fissure with the micro scissors. Now a little bit deeper into the sylvian fissure, you can just start to see the patient's left optic nerve in the top right portion of the screen. And overlying where I'm cutting right now, deep to that, will be the left internal carotid artery as it enters into the skull. Which can be seen right under my sucker there. A second retractor blade is being applied now to the temporal lobe. And with that retractor in place, between the two retractors, you can see a very bright white circle right beneath my sucker now. And that is likely the dome of the aneurysm, which now is a little bit more in view. I'm continuing to work near the carotid artery in order to make sure that if indeed the aneurysm does burst during the procedure, that I will have the ability to control the blood flow in front of the aneurysm by closing that down with a temporary clip if need be. Here I'm further exposing the arteries that lead to the aneurysm, and the aneurysm itself you can see just underneath my sucker with the very white dome. Here we're starting to see the aneurysm better, and I will work to remove the adhesions as well as the normal brain surrounding the aneurysm off the aneurysm itself. On the left side of the aneurysm, I feel that the exposure is quite good at this time, and I'll further work to release that completely from the patient's temporal lobe. The purpose for doing this is to make sure that you have complete visualization of all of the normal blood vessels coming to the aneurysm, but also bypassing the aneurysm and going to normal brain. If there are some adhesions that are significantly adherent to the aneurysm, cauterizing them, which was done there, and cutting them sometimes is safer than actually trying to dissect them off the dome of the aneurysm itself. As you can see here. Now, once again, dissecting and identifying the neck of the aneurysm, creating space between the normal brain and the aneurysm neck itself. Once we have circumferential exposure of the aneurysm, then I can feel confident that clip placement will be as safe as possible. So at this time, the aneurysm appears to be completely free of adhesions, and a clip can be placed. So here, this is a slightly bent clip. There are many different shapes of the clips that we can use, and each aneurysm is individual. So you may think that you have something planned out before the aneurysm exposed, but most times I end up changing to a different clip based on what is found during the procedure itself. Here I am gradually placing the aneurysm around the base of the neck of the aneurysm, and once I feel confident that the aneurysm and its entire neck is within the clips, I will close the aneurysm blades, or the clip blades, I'm sorry. After the clip has been placed, you need to verify that all of the other vessels are still patent and flowing, and this is performed by one of several methods. This is the microdoppler, which tests the blood pulsations that you can hear audibly. This is a separate intraoperative picture that you get with the microscope where you inject a certain dye and the vessels light up, and anything that does not receive dye will stay nice and dark. As you can see, I'm moving things around with the suckers. The aneurysm dome now has a slight white tinge to it, where you would hope that that would be completely black. So that's evident that there is still some flow into the aneurysm itself, and a second clip will be needed in this patient. Here is the second clip. If you look at the very deep portion of the aneurysm, you can see that there's a very small bit there by the sucker that was not closed. So I selected a slightly longer clip and placed that directly over the previously placed clip. Once this is performed, a final intraoperative angiogram will be performed to ensure that all the blood vessels are open and the aneurysm is indeed treated.